I had gained a lot of weight really rapidly, around 40 pounds, I would say. I didn't even recognize myself. I was honestly embarrassed. I was at the worst mental place that I've ever been in my entire life. I wish, with all of my being, that I could just go back to sophomore year and just give her a hug and tell her, it was gonna be okay. I was practicing 7 to 10 times a week. Sports have always been the biggest part of my life. I was honestly embarrassed, to be honest with you, and I didn't talk about it much. Nobody really addressed it. I would talk about being tired. At the time, I thought that I had PCOS because I was diagnosed when I was really young. So I would talk about my PCOS is flaring up this week, not feeling well. I was constantly tired, just feeling super weighed down all the time. And it really got to a point where I knew that I needed to start looking into it. It was really affecting my mental health. One night, I was just at my breaking point. I wasn't understanding what was going on. I was so upset with myself for not being able to perform the way that I wanted to. And I had dialed my coach's phone number and I was going to call and I was going to quit. It was so frustrating. I changed so many things that I was doing. I cut out gluten and dairy completely. I still am gluten-free because I figured out eventually that that is what works for me with my health. But at the time, I was doing everything in my power to make changes, and I wasn't feeling the changes, and it was so frustrating that my brain wanted to do things to get better, and it just wasn't happening. And especially from playing a mental sport, softball is so mental. And when my brain knew what I needed to be doing to perform correctly, but my body wasn't doing it, it was just so frustrating. That summer was kind of my breaking point. I was thinking that it was PCOS related, so I decided to schedule with a new OBGYN. She had mentioned that she didn't think that I had PCOS, but instead that it was maybe something like hypothyroid. So she ordered some blood work. The blood work confirmed that I no longer had PCOS. She tested my TSH as well, which came back completely normal. So I left that appointment honestly feeling pretty frustrated again. I felt like I had been waiting so many months for the appointment, and then I left with less answers than I had going into it. That is when I started doing a little bit of research. I found a couple of peer-reviewed articles that talked about getting tested not only for TSH, but also for T3 and T4. So I looked into an integrative medicine practitioner who was able to order a full panel of blood work for me that included thyroglobulin as well. And that is actually what ended up coming back elevated for me. So then I took that to my PCP, who ordered an ultrasound for me. And through that ultrasound is when they found 2 nodules, one on the right side of my thyroid and one on the left. And the radiologist scored them both a 5 in terms of suspicion. So after that, then I was referred to an endocrinologist back home in Maryland. They had a little bit of waiting time as well to get in, to get the biopsy done. And at this point, we had made it to summer before my senior year. By the time that I was able to get in and see this doctor, my appointment was actually canceled 3 times. I was able to see her, but it ended up being 10 days before I was supposed to go back to school. I came back to Tennessee and I sat down with my coach and I told him what was going on for the first time. And he got me in to talk to the athletic trainer right away, who we had actually just established a new relationship with Vanderbilt. Thank goodness, because Vanderbilt has been so amazing in this whole journey. But they got me in immediately to see our sports medicine doctor, who then referred me to the ENT, and I was getting a biopsy within the week of seeing that ENT. So then I ended up being diagnosed originally with papillary thyroid carcinoma. So I actually found out at practice. My coach was aware that I was waiting for news, so I was practicing with my phone in my pocket. My phone started ringing, and I think I was holding the ball at the time. I honestly don't really remember, but I think I just dropped my glove, and I ran through the dugout out towards the shed. But I had this like weird trauma reaction when he told me. I couldn't stop laughing. Like, it was the weirdest thing I've ever experienced. He was like asking me all of these serious questions about treatment options, and I was just cracking up. Like, I had to mute myself multiple times. I felt so bad. But that's just how my body reacted. Like, I had no control over it. That phone call ended, and that was hard to hear, but the hardest part by far was having to call my dad and tell him. He was 12 hours away from me. I'm his youngest child and his only daughter. At the time, my mom was actually very sick as well, so he was sitting at her hospital bedside when I called. That was the hardest thing I've ever had to do. So my plan going into surgery had been just to remove the right side of my thyroid because both of my nodules were biopsied and the left one came back entirely benign. And I also was 21 years old at the time. The thought of being on medication for the rest of my life scared me a little bit. So the fact that he was giving me the option to keep half of my thyroid was super important to me because it meant that I might not have to be on thyroid replacement hormone for the rest of my life. So that was my plan. And in addition to that, I had had multiple scans showing that my lymph nodes were clear. There was no concern going into it. But because my thyroglobulin was elevated, he had decided to also do a central neck dissection during my surgery. So he removed 7 lymph nodes, and 1 came back as cancerous. So then my diagnosis had switched from papillary thyroid carcinoma to metastatic. This whole experience has made me so incredibly grateful just to be here and has given me a new perspective on life that I'm so grateful to have, and I would not be able to have if I had not gone through this journey. But at the same time, there have been people who have definitely tried to diminish it, but there have been a couple of conversations that have made me really struggle with the fact that this isn't something that I should be going through. This isn't something that anyone should have to deal with. Now, most of the time, I don't really think about it, but on the other hand, every time I go to practice, I either have to wear sleeves or I have to reapply sunscreen to my scar every 30 minutes. So it's either be super hot in my sleeves under my jersey or just constantly remember to put sunscreen on. I still deal with a lot of scar pain. This week I have to get more blood work done, and that has brought up a lot of emotions, especially just, I don't know, what if my blood work comes back not great again? There's always that fear in the back of my mind that I think I'll live with for the rest of my life. That yes, on one hand, I'm here and I'm living and I'm still able to play softball and be a college student, but at the same time, there are also things that aren't ideal. I've done a lot of work mentally and in therapy to get to the point where I am now, and to the point where when I was diagnosed, I wasn't in a bad mental space. Like, 2 years ago, if I would have been diagnosed, I don't know how I would have handled it. But the whole journey, kind of like I said, and gaining this new perspective on life has just changed the way that I look at everything. And I think that it has made me so much stronger as a person in general. And I'm so grateful that I didn't quit that day that I wanted to, because I think from a mental toughness standpoint, if I would have quit, I never would have been able to get to the point that I am today. And in addition to that, I never would have seen that I was able to get to a point where I am today and kind of prove to myself that I can grow from something like this. Just continue to listen to your body. Like, we know our own bodies better than anyone else does. And doctors are amazing and they have so much knowledge, but they can't feel the way that we are feeling 100% of the time. So if you think something is wrong, if you aren't feeling like yourself, go get it looked at.
If you were inspired by this story, we've queued up another one for you here. And please make sure you subscribe to the Patient Story community, where we're humanizing cancer one story at a time and always reminding people you're never alone.